Okay, this is elbow, wrist, and hand. Okay, first, radius, ulna, ulnar tuberosity, or radial tuberosity, ulnar tuberosity, medial epicondyle, lateral epicondyle, and then olecranon. Okay. Then going down, turn your hand over. MCP joint, PIP joint, and DIP joint. Okay. And then going to biceps is scapula, or origin is scapula, insertion is radius, and action is elbow flexion. Okay, and then triceps, origin is scapula and humerus, insertion is olecranon, and action is elbow extension. Okay, and then extensor carpi radialis brevis, origin is lateral epicondyle, insertion is third metacarpal, which is in the hand, and then action is extension. Okay, and then extensor carpi radialis longus, origin is lateral epicondyle, insertion is second metacarpal in the hand, and then action is extension. And then extensor carpi ulnaris, origin is lateral epicondyle, insertion is fifth metacarpal, which comes all the way down, and action is extension. Flexor carpi ulnaris, origin is medial epicondyle, insertion is pisiform, which is in the wrist, and action is flexion. Flexor carpi radialis, origin is medial epicondyle, insertion is second metacarpal, and then action is flexion. Extensor digitorum communis, origin is lateral epicondyle, insertion is distal phalanx, which is all the way down in here, and action is extension. Okay, and then flexor digitorum superficialis, origin is medial epicondyle, insertion is middle phalanx, and action is flexion of MCP, which are these, and PIP, which is there. Flexor digitorum profundus, origin is medial epicondyle, insertion is middle phalanx, and action is flexion of MCP, PIP, and DIP. Okay, and then there's themenar eminence and hypothemenar eminence.